the Staphylococcus. It is resistant to methicillin, and it is hospital-acquired mostly.
Especially with us ladies, the way the Lord made us, our genital area is usually quite moist, whether you're in your periods or not. You'll notice there comes a time that your panty is stained and you're not having an infection or anything, you're just moist. So it's good to change your underwear daily.
Okay, now to the vagina is very self-cleaning. Okay, you don't need to put your hands into your vagina. You don't need to steam your vagina. You don't need to barbecue it. You don't need to saute it. Yeah. You don't need to, you don't need to scrub it. You don't need to douche. Yeah. It means putting water and soap into your vagina. It's not a toilet.
Anything that you literally walk with around, it's good for you to constantly disinfect them.
Yes. Okay, so she talked about just the ladies. Please, males,
yes.
Please, yes. Hygiene is not just for females.
We also have
please stop using one boxers for 1 week.
Turning it inside out and then
exactly,
back to front.
Or smelling. Like if you have to smell your boxers before wearing it, then you know that there is a problem. So even males, you need to change your boxers every day. Because even if, for example, women go to the toilet and they use water to flush after urinating, right? Males go to the toilet, but they do not do that. They just do this and then they leave. But remember, some part of the urine might still be at the tip of the penis, and then it will touch your boxers, okay? Some people have pre-cum, some people have, you sleep overnight, and then you wake up with an erection, and then, sometimes you might just spill, or you have sexual intercourse, and then you spill. So it doesn't matter whether you have used your penis for anything in the morning or in the night, whatever it is, that area is moist also. You don't have to be female. There's heat, there's moisture. It depends on your environment, but the body will definitely sweat. The body your groin area will definitely, shed some dead skin. Yeah. So it is hygiene or changing underwears every day is not peculiar to just females. So please, my dear males, it is also for you.
Hi. Now, I don't know if you're old enough to remember a certain episode of Tyra Banks when she used to have a show back in the day. She used to send out some forensic cleaners to different people's offices or homes, depending on what they wanted. And when they came back with the reports, they were shocking. People found in the office, there were some surfaces that had this kind of bacteria or that kind of bacteria. But the one that stuck out in my head was the microwave, which had traces of human feces. Yes, there you go. That was on a show, and it was multiple times. This is the Med Squad podcast, where we have candid conversations about health and wellness across Africa. And my name is Yafesi Musoke, and we are going to be talking about hygiene and giving you some micro habits that can make a macro difference in your life. And I have some very hygienic ladies with me here, so start to decide to introduce yourself.
Thank you, Yafesi. My name is Dr. Flavia Bagatya, and I'm a medical officer.
Yes, and very hygienic.
Hello, my name is Dr. Kelechi Okoro. I'm also known as the health entertainer, and I'm used to breaking down taboos and myths around topics like this.
Hi, Yafesi. My name is Georgina Nyaka, general practitioner at Zuri Health.
All right. So now when we're talking about health, or rather hygiene and those micro habits, let's first be a bit honest with ourselves. How often do you change your towel?
As often as I should.
What does that mean? As often as you should? Some people have a different should.
Okay, so I have lots of towels, so I use one every day. That's a bit excessive, but that's what I do.
The luxury, soft life, okay.
Twice a week.
Twice a week.
Mm-hmm. After 3 days.
After 3 days. So I'm the only one here who can actually grow a small garden on my towel. All right. So, how often should you change that? We'll get to that. Mm-hmm. Let's talk about flushing with the lid up or down.
Okay, so we've been flushing with the lid up, but recent studies have shown that even when you flush with your lid up, it doesn't actually reduce the bacteria or the spread of bacteria. However, there's been recent advice that you should flush with your lid down for cases like when you have your toothbrush around and when you have some of your products around, so that you can have some kind of explosive diarrhea, and then when you flush it, everything just splashes out.
So I was asking, what do you do?
I flush my
the lid down.
Yes.
Okay.
Up.
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 Yes, these are living the dangerous life. Life of the edge. And then, how often do you disinfect your phone?
Rarely.
Rarely.
Okay, so I always have alcohol wipes.
Uh-huh.
So I disinfect at least after every day.
Okay.
Remembering that I take my phone to the toilet.
Yeah.
I take my phone everywhere I go.
Yes.
So, and I have disinfectant wipes in my bag. So why not?
Okay, Georgina.
So, okay, since I'm in a hospital environment, if I were somewhere else, maybe it would have taken time for me to. But since I'm in a hospital environment, twice a week, or at times I forget to, but at least twice a week.
Some of us are still, when my phone, there was a time I didn't recognize, oh, this is cute. There was a time I didn't recognize my phone because it had changed color. But we come to something else that might change color. How often do you change your bed sheets or pillowcases?
I do it once a week.
Once a week. Huh?
I do it once a week.
Once a I was expecting you to say like twice a day.
Okay, so if you want the candid answer, I'm a nomad, so I literally wake up every day in another hotel or in another apartment. So
Okay.
a fresh bed sheet every day.
Okay.
Once a week.
Once a week. Huh. Some of us have given the friends we have their names. Right. Actually, in high school, was it in boarding school, some people don't change for the whole term. They don't change their bed sheets because that's how they recognize them, by the smell. Now, we want to give some tips, some just simple things, little micro habits that make such a big difference in everyday health. And the whole thing with washing hands, of course, during COVID, we had a whole sing happy birthday or whatever it was. But what is without having to think too much, what is the basic when it comes to washing hands? And what should we not forget?
Okay, so when you want to wash your hands, make sure you wash your hands with soap and running water. Okay, let me just take us back to our African culture,
Yes.
right? Most times when we want to eat our swallow, our fufu, and the rest of them, we wash our hands with only water, not because we're trying to be clean, but because we don't want the fufu to stick in our hands.
Aha.
So you're supposed to wash your hands with soap and water before you eat your fufu, and then soap and water afterwards. So running water is the key word. But if you do not have running water, don't put your hand inside the bowl.
Oh, okay.
So get someone to pour water over your hands so that you don't wash and still wash into the dirt and leave it there. Okay, so and then wash before after every toilet visit. Okay, and then sometimes, sorry, I'm trying to be practical. If you say wash
Yeah.
after going to the toilet,
Yes.
remember that you leave, if you're in a public restroom, you use the WC, right? And then you still hold your phone and then go out, wash your hands, and then still hold the same phone. Right? So just have that mental note and know that you're supposed to wash your hands
Yes.
before, after. Okay, you're supposed to wash your hands before contaminating the same device or your handbag that you're going with. So wash your hands before, after using the toilet. Wash your hands before and after eating.
Yes.
Wash your hands after handling money. Wash your hands before immediately you get to your house.
Yeah.
After a long day.
Yes.
Wash your hands before handling babies.
Yeah.
Yes. So you all wash your hands after using
After handling pets.
after handling pets. Yes. Wash your hands too.
Ensure that you wash all the surfaces of your hands. And then it's recommended that you do it for about 20 seconds. Some say you sing the happy birthday song so that you ensure proper hand washing.
Yeah. Now, if you're in an area where water is a scarce commodity, is the water running during the 20 seconds or is the 20 seconds for scrubbing, like your fingernails and all?
It's for both scrubbing and then the rinsing. But also, if in case you're in an environment where water is scarce, sanitizer is important because it reduces the spread of infection it kills microorganisms by 90 to 99%.
Don't the germs just sit there but they're dead when it's sanitizer? So, like, at some point, won't you have to wash off everything?
But then you're not spreading them.
Okay.
They are dead.
And so when you're washing your hands, make sure you're scrubbing your nails this way, that way. And then for those who have long nails, that means you have to wash extra harder because you have long nails and then they can bacteria and dirt can trap under your nails. So
Yeah.
wash like you're about to get into a surgery. Like I said, about to have a surgery.
Get into a-
Wash like you're about to
perform
a surgery. So like this, like this.
And then you walk like this around the house because you haven't changed your towels.
The one
right?
also
Yeah.
on the,
Yeah, like this.
At the back also.
yeah.
So we're also looking at not just hand washing, but proper hand washing.
Proper hand washing.
Yes. And there is overwhelming evidence that it prevents hospital-acquired infection by 50%, including the prevention of the spread of microbacterial resistance.
Hey.
MRSA.
Yes. So we're looking at organisms like the methicillin Staphylococcus aureus, methicillin-resistant Staphylococcus aureus.
That you pick from hospitals?
Yeah, you can pick it from hospital.
Or from dictionaries even, because what did you say?
Methicillin.
Yeah.
So this particular bacteria, the Staphylococcus, it is resistant to methicillin, and it is hospital-acquired mostly. And it's mostly spread by contact.
Okay.
So with proper hand hygiene,
Yeah.
you can spread the spread of such organisms.
So I wanted to ask, just based on what you're saying, obviously, like even right now, if I touch my face, I know my hands have bacteria. There are people who have this philosophy or thought process that, especially going to the washroom, I wash my hands before so that I don't infect myself or touch myself with the things that might infect me. And then because they think that keeps them clean, they now don't afterwards, they don't wash their hands, they walk out.
But
you shake your hand.
Then you're being selfish. You're washing your hands because you're preventing spread to yourself from other people. But then after that, you're going to spread your microorganisms to other people.
And also to
It's
yourself.
important to-
So it's just a pennywise pound foolish kind of behavior. So even if if you come out without washing your hands, you're going to first infect yourself before you even contaminate others.
Okay.
And it's also important to know that people who don't wash their hands from the toilet, we're looking at fecal-oral diseases, the spread of fecal-oral diseases. Diseases that are spread by fecal-oral route, like the typhoid, the salmonella.
Yeah.
So it might not affect you. You may not get the symptoms, but you're spreading it to other people, and they're going to get infected with your microorganisms, and they're going to get the
When you
infection.
touch microwaves and elevator buttons, which other people use.
Especially food handlers.
Yes. And I've seen them dressed in uniform and they walk out in a mall. I will not name the organization, but looking at another habit, a micro habit, we talked about personal items. Like Georgina, you mentioned, because of the environment you work in, especially like your phone. So how do we deal with like things like phones, keys, and are there personal items also that you pay special attention to?
Yeah. So what I would recommend, it's good to always have a disinfectant with you, be it in liquid form, be it disinfectant wipes, something that you can always use to disinfect your phone. Car keys. What else do we normally hold? Eyeglasses.
Yes, yeah.
Anything that you literally walk with around, it's good for you to constantly disinfect them.
Does this apply to things like jewelry?
Yeah.
Because sometimes you see a woman holding her baby and then the child grabs the beads or whatever and puts them in the mouth. And I'm like, yeah. So sometimes, yeah. How do we disinfect those things without either discoloring them or affecting their integrity, structural integrity?
You can use alcohol wipes to disinfect them, but also most of our jewelry is fake jewelry. It's gold coated. So either way, you're going to.
But
it's
now
going to
that's
tarnish.
the fakeness is going to turn green.
But also wanted to add that it's not a healthy habit to take the phones to the toilet because you're contaminating them in that way.
So, phone in toilet. I think, okay, actually explain it, because some people don't understand what the issue is. As long as I'm not touching either the fecal matter, is it the atmosphere? Are there particles in the air? What is it about phone in the toilet?
With using the phone in the toilet, you're on it as you're doing your business.
Yeah.
After that, you're going to go put it down, wash your hands, and take it back.
Yeah.
So you're contaminating your hands again.
Yes.
Then also, apart from that, you're going to flush the toilet, and then there's that plume, the aerosol substance from
Or like a waterfall. Wait.
Yeah, but it's more of the mist,
Yes.
the toilet mist.
That mist.
It's going to contaminate your phone again, and then all the surfaces around.
Okay. All right. So you've had not to,
Sorry, can I add something?
Yes, you may.
Other surfaces that you should also disinfect, the door handles,
Yes.
your door handles, your handbag for females. We're always holding our handbags.
Yeah.
Okay, so same thing. You take your handbag like you're in an airport. You can't leave your handbag outside. So same thing that applies with like the phone. You take your handbag into the toilet. You drop it. Do your business. Pick it up. and then go wash your hands, pick it up again.
And car steering wheels.
Car steering wheel, whatever is the staircase.
The banister, yeah.
Exactly. So just have a mental note. What are the things that you touch often? And then just make sure you disinfect them.
Okay. Now, when we come back, we have already touched on something, but we're going to get into more detail about it. It's a habit that we all take for granted, but in some cases, it's a structural issue. Right here on the Med Squad podcast. We'll be back. Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury, it's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. And we're back. Welcome back. It's the Med Squad podcast. I have the Hygiene Squad with me. Yes, we're helping you keep things clean so that you have good, healthy habits and you don't get infections that you can't even understand. Now, earlier, you had mentioned having the phone in the toilet, that's one thing. Now, talking about flushing. So here's the thing. After all the work I've put in to release the Kraken, I want to have closure and watch it go. Especially like if I'm visiting someone's house. I don't want evidence that I was there having a moment. So I want to make sure it's gone. So that's why maybe some people flash with the lid up. So they want to watch and say, yes, I did that. That's my work. It's gone. We have closure. Also there are other people. Yes, I was talking about structure. There are toilets in the house. They don't have lids because of the landlord not being vigilant, or maybe the kids broke it or something. So what is the proper procedure when it comes to flushing? What do we do? Do we just leave things as they are, or is there a way to mitigate the flushing action?
So because of the plume like we talked about, that the mist that contains the microorganisms from the bowel. Yes. It's better to flush when the lid is down, because that plume containing those organisms is going to contaminate the surrounding surfaces, the toothbrushes, the sinks, the taps. So
The towel.
the towels. So that's why some people flush with a lid down.
What do you recommend? Some people will flush with the lid down, but your recommendation is that's
Okay.
the procedure.
You talked about those who do not even have a lid. So if you're talking about recommendation, how about how many people who do not have lids?
Yes.
Okay. There are some toilets that do not even come with lids. We are in an African setting, local setting, where you just have, the one that is just open and there is no provision for lid.
Yeah.
Okay. So what you do is no provision for lid. Make sure you move all of those, your toothbrush, your towel, anything that you know that might get contaminated when you're flushing with the lid open. Just make sure they're not just close to that area. Okay. For example, some people have their toothbrush just at the back.
Yes, on the cistern.
Yes, just at the back there. Yes. So there's no need to put it there. Put it far from there. And also, if it has to be there or anywhere else, make sure it is in a container that has a cover.
Yeah.
Okay. Yes. But don't forget that because it's in a container that has a cover, there is no chance of contamination there too, or it cannot be an atmosphere for cultivating microorganisms. Of course, when it's an enclosed container, there might be moisture from the toothbrush. So you know that you have to still wash every now and then, in fact every day, and make sure that you dry before storing.
Yes. And there's another habit.
To prevent or to control the spread of these microorganisms, some people put detergent, either in the bowl or the cistern. That detergent helps, one, to reduce the spread, and then two, to kill the odor. Yes.
Is it better to mix detergent with disinfectant? We have lots of adverts that say, don't do that, use this cleaner that costs this much money. But is it a viable option? Put disinfectant in the cistern so that when it flushes, it kills things on its way down.
It has to be the right type of detergent, because if you put just any, you're going to, the cistern comes with different parts. You're going to corrode those parts.
Aha. Hey, okay. That gets tricky. Now, for Georgina,
Yes.
this one I want to ask about. So, I don't even know why it's an issue. People talking about, there's a question about whether people should change their underwear daily. I don't know if that's an African question or from somewhere else. So what is the issue that is being addressed here? Is it the material or is it the frequency of changing?
So let me go back to the toilet. So yes, we should flush with the lid down to prevent microorganisms from spreading into our environments, yes. And also on the toothbrush, those who use the containers that can be sealable, make sure you just wash those containers as frequently as possible. And again, toilets are supposed to be washed daily.
Yes.
Yes, there are some of us, I know some of us have busy schedules, but remember, the moment you've used your loo for a long call, a short call, you flushed, even that lid that you've closed, it still gets contaminated.
Yeah.
So imagine a lid that has been that way. Yes, you flush with your toilet down, but you still have to use your loo. So you open it up again, and then you're not washing it. So it means it comes a time that your toilet is literally full of bacteria all around.
Yeah.
Now going back to what you've asked me, underwears and innerwears for ladies, they should be changed daily.
Yeah.
And you should also bathe daily. If you can afford to bathe in the morning and in the evening, the best for you. Especially with us ladies, the way the Lord made us, our genital area is usually quite moist, whether you're in your periods or not. You'll notice there comes a time that your panty is stained and you're not having an infection or anything, you're just moist. So it's good to change your underwear daily. And for us who bathe twice a day, after you've bathed, don't put on back the one that you had during the day.
Yeah.
Just use a fresh one.
Use a fresh one. And that other one, you hang it in the sun.
Yes, actually, for ladies, wash your underwear with soap and water, rinse it well, and leave it to hang in the sun to avoid fungal infections.
Okay.
Okay, so she talked about just the ladies. Please, males,
Yes.
please, hygiene is not just for females.
We also have
Please
to hang
stop
our
using
underwear.
one boxers for 1 week.
Turning it inside out and then back to
Exactly,
front.
or smelling. Like if you have to smell your boxers before wearing it, then you know that there is a problem. So even males, you need to change your boxers every day. Because even if, for example, women go to the toilet and they use water to flush
Yeah.
after urinating, right? Males don't go to the toilet, but they do not do that. They just do this and then they leave. But remember, some part of the urine might still be at the tip of the penis, and then it will touch your boxers. Okay. Some people have pre-cum. Some people have you sleep overnight and then you wake up with an erection, and then sometimes you might just spill. Or you have sexual intercourse and then you spill. So it doesn't matter whether you have used your penis for anything in the morning or in the night, whatever it is, that area is moist also. You don't have to be female. There's heat, there's moisture. It depends on your environment, but the body will definitely sweat. The body will your groin area will definitely, shed some dead skin.
Yeah.
So it is hygiene or changing underwears every day is not peculiar to just females. So please, my dear males, it is also for you.
Yes, there are crevices that need some attention.
So with underwear, also the material matters.
Yeah.
It is recommended to use cotton material other than the synthetic nylon.
Yeah.
Because with nylon, there is moisture and they don't easily dry. So it will remain moist for a long time, especially with discharges. So with a warm, humid environment, it's favorable for fungal growth, like she said, for conditions like candidiasis. So to prevent that, it's good to use the cotton breathable panties.
Okay, yeah, so sorry, something else you mentioned. For your underwear, make sure you wash with soap and water and then hang under the sun to dry. But if there is no sun, you can iron.
Oh, you can iron?
Yes, you can iron. Because you won't say, oh, because there's no sun to dry my underwears, then I will just leave it like that. No, you can actually iron so that that heat can, be applied on the, on the material. And then, yes.
That's good for people who live in apartments where if you hang things outside, they're gone.
Exactly.
And now you mentioned something pretty important. Fine, you have this underwear. This is my plan for the day. This is what I'm wearing. But then what happens after you say sexual activity? So normally people just put back on the clothes they were wearing, the underwear they were wearing, and then go about their day or go about their life. So what happens in such a case? Do you carry a night bag? Do you carry a spare?
Okay, well, so if it's an impromptu appointment or you're not in your house, I mean, not everybody would go with an extra panty or underwear. So when you get back home, you can just do your make sure you wash up and then change your underwear, right? But if you're outside or somewhere you cannot change your underwear, we can forgive you for that moment. But however, you know that you're owing your body one hygiene tip or one hygiene, procedure. So when you go back home, make sure that you clean up and then change your underwear.
Okay.
But you should also not forget that after you've had sexual intercourse, for both couples, male and female, just take a shower afterwards.
Okay.
Yes.
There are these things we see in the market, intimate wipes. Do those, or do you just go full on shower?
For people who, like she's mentioned, it's an impromptu visit and you don't have that chance to shower, you can use them. But the best advice, if you can afford a full-on shower, just do a full-on shower. It is way more effective than the wipes. The same way we say for children, most mothers nowadays carry diapers and baby towels. But again, if you're in the house and you can afford to wipe your baby with water, and that, we used to call them liners in the olden days when people used napkins and a liner. Just do it. Like there's no harm in wiping your baby using that liner, water and soap, and another person who's using the wipes only. So it's also good for people to know that for mothers who use wipes for babies, don't use wipes that cause irritation. Use the water-based wipes because baby skins are quite sensitive. Yeah.
Now, when we talk about either bed sheets or things like that, in fact, even the argument with bed sheets applies even to towels. Why is the towel dirty if I've just taken a shower? And also, when I'm going to sleep, I took a shower, so I'm clean. What's this about changing my bed sheets every 2 days or every day?
Yes, because your body keeps on producing oils. That's one from the sebaceous glands. Then we're looking at, it keeps on shedding the skin. So we're looking at dead skin on the bed sheets. You also sweat in the night. So sometimes fluids spill over onto the bed sheets. So it's important to change them. Also to prevent the skin conditions, then the odor, plus also acne. When you're looking at pillowcases, sometimes people drool saliva onto them. So it's important to keep on changing as often as possible.
All right.
Before we continue, also our bodies, our skin is constantly shedding.
Yes.
Whether you've taken a shower or not, our bodies is constantly shedding skin. So on the surface of the beddings, we find something called dust mites. So over long, when you do not change your beddings as frequently as possible, this should be about three times a week, or after 3 days, it's okay for you to change your beddings. So when we dwell on that dust mite, your skin, as she's mentioned, you're prone to getting acne from the oil, from the dust mites. And also for people who are asthmatic, overproduction of those dust mites and When the environment becomes dumpy, they are prone to getting an attack.
Well, okay. So you can also cover this thing with towels, sponges, bath equipment. The leaving it wet or leaving it damp. So some people have a face flannel and they're like, it's okay, even if it's damp from yesterday or the previous, it doesn't matter. What do you tell such people?
Or you tell them that wet towels, wet towels, wet blankets, whatever it is, it's an atmosphere that can encourage the growth of bacteria, growth of yeast. Okay, and then when you use it, for example, imagine your towel is wet and then you use it to clean your sensitive areas. Yeah. You can just, there might have been a growth of yeast, and then you just transfer it into your sensitive areas like your vagina and that. So it's very important that after each use, you dry properly before you use.
Yeah.
Yes.
It's the same thing in the sun or the ironing.
Oh, sun or ironing, whichever works for you. I mean, if there is no sun, it's winter, there's no sun. Are you going to go to Africa and get sun for it? So you use the sun. If there's sun, put it outside. If there's no sun, you can use your iron.
Then also for the sponges, you do the same. It's good to keep them dry. So after use, you make sure it dries. Put it in a well-ventilated place to dry, because when it's moist, you're harboring microorganisms. Okay. Then it's important to change it about 3 to 4 weeks. Every after 3 to 4 weeks, we change the sponge.
Okay. Okay. What I was going to say was, one of the things that...
Sorry, I just remembered.
You just remembered.
Also very important, you're supposed to have a different towel for your body and for your face. That's very important. And also change your toothbrush at least every 3 months.
What about families, they put their toothbrushes together? Is there anything wrong with that? Then they so it's a container full of like 4 or 5, 6.
No, everybody should keep their toothbrushes separately and know that this is mine and this is yours. So you have to use your toothbrush just for yourself.
How deep should I go with cleaning? Now, there are people who put in things inside their ear and really yank out the wax, enough wax to start a candle factory. But how deep should I go, even scrubbing? There are people who really scrub themselves in private areas. Isn't the body in some areas self-cleaning? Okay,
so there are two areas of the body I'm going to talk about. First, the ear and the vagina. The ear is self-cleaning, and also the wax you see in your ear, it has a biological function to lubricate the ear, to trap dirt and organisms, and then protect your ear from infections. So you're not supposed to put the Q-tip is not for cleaning inside of your ear. It's for cleaning the outer ear, and then any extra wax that comes out of the ear.
That you can see.
That you can see.
Or the visible wax.
Exactly. Because if you notice, the more you clean your ear, the more it itches you, and the more you feel that there's a need to clean your ear. So you're doing something that is against the physiology of the ear. Okay, so, but there are some people who overproduce wax because of some kind of medical conditions they have. So those ones, they have the wax come out more often so they can clean just the outside. But if you feel like you have cleaning the inside of it, if you feel like, you're overproducing wax and then you need to clean, then you should see a doctor and get it cleaned medically. Okay, now to the vagina is very self-cleaning. Okay, you don't need to put your hands into your vagina. You don't need to steam your vagina. You don't need to barbecue it. You don't need to saute it. You don't need to, you don't need to scrub it. You don't need to douche. It means putting water and soap into your vagina. It's not a toilet. It's a vagina. Okay, if you ever feel that there's a need to scrub the inside of your vagina, maybe because of odor or some kind of discharge, yellowish discharge, offensive smell, egg smelling, and then that means you should see a doctor. Okay, and then you talked about intimate wipes earlier. Intimate wash also is a problem. You do not need any intimate wash for your vagina, right? It is self-cleaning. Even after your period, you don't need to soak your vagina inside hot water or Dettol or disinfectant or anything. Just, you notice that after a day, the color would, it first, during your period is bloody. After your period, the next few days is brownish, and eventually it will get clear. You don't need to put a brush into your vagina and clean it out. So even the intimate washes, like I was talking about, they disrupt the pH of the vagina. Okay, they kill the normal bacteria in the vagina that's supposed to, protect it from vaginal infections. So you're not supposed to clean the inside of your vagina. So on social media, when doctors say you're not supposed to clean your vagina, there's always an outrage that, oh, why are you not going to clean your vagina? It's because the layman thinks that the vagina is the vulva. The vulva is the outer genitalia, what you see on the outside.
Okay.
Why the vagina is what you see from the orifice that you see from the outside, the muscular tube that connects the outside to the cervix. That's the neck of the womb. So what we're telling you not to clean is the inside. However, for the outside, you can use tepid water and just clean tepid water, right?
Yeah.
If you need to use soap, if you need to use the soap, it has to be unscented.
Unscented soap.
And not antiseptic soap.
Okay. So now as we wrap this up, there's one that is ignored, especially by the gym bros. They're drinking the water bottles. Isn't the water clean? Why am I now washing the bottle? Oh, I don't know what. And then as you go with that, there was some, before we even get to that, there was something about toothpaste. The proper
Toothbrush.
Yeah, whether we, as part of hygiene, whether we spit out everything, rinse out everything, and we go about our day, or are we holding on to the toothpaste for the fluoride? I hear there's something like that. So those two, gym and the toothpaste.
Okay, let me just take the brushing part, the question. First of all, you're supposed to brush twice a day. Second, you're supposed to not just, when you say brush your teeth, it makes people just brush their teeth and forget their tongue. So you have to brush your teeth and brush your tongue twice a day, in the morning and before you sleep. And also when you brush, make sure when you're done brushing, you don't rinse your mouth immediately because you want the fluoride in the toothpaste to remain in your mouth because it helps protect your enamel and keeps, strengthening your teeth.
Yeah.
So when you finish washing, just spit out and don't, rinse out your mouth because you want the fluoride to remain in your mouth and then, protect your teeth. It strengthens the enamel and also protects the teeth. So if you have to rinse your mouth, wait until after 30 minutes before you do so.
So the people there are some who brush their teeth before breakfast because it's a routine on your way out to go to work. So if you have toothpaste in your mouth, you won't be able to eat. Yeah.
No, you don't have to have toothpaste in your mouth. You spit it out. Spit everything out. Don't leave toothpaste in your mouth. Spit it all out, but do not rinse. Because remember, while you were brushing, you have spread evenly the fluoride toothpaste in your mouth. So just spit it out and go about your business. But if you have to, it's not a hard or fast rule. If you have to, then you can rinse 30 minutes later. So when you get to wherever you're going to, you can just rinse it out and then, that's fine. And then back to the vaginal hygiene. It is very important that women clean after going to defecate, after going to do the number 2. It's very important that you clean from front to back. Because if you clean...
The cleaning motion.
Yes, the cleaning motion from front to back. Because if you clean from back to front, you can transfer, bacteria like E. coli into the vagina that will cause infection. So the bacteria in the feces is not supposed to get to the vagina. So you have to clean from front to back. And it's better to clean with water.
Yeah.
I have a routine. First, clean with tissue, then clean with water so that when you're washing your hands, you have less contact with the feces and with fecal matter. Yes, clean with tissue and then wash with water and then dry with tissue.
Okay.
Yes, and then go wash your hands and dry your hands.
Front to back. That's why it's called bacteria.
Right. So, got jokes.
Georgina, the gym people, you come and the ones who walk around with their Stanley cups, those big, they get bigger every year. And they don't wash them, they don't disinfect them, clean them, because, it's just drinking water.
Okay, so it's important to wash whatever material you're using, the cup, the bottle, daily. So you've woken up in the morning, you've used it. In the evening, when you come back to the house, make sure you wash it. Why? As you've mentioned, you're going to the gym. So you've sweat, and then that bottle of yours, you put it right back in your bag. The same bag that maybe you'll walk into the washroom with, or maybe you'll put in your car. Surfaces are always contaminated. The steering wheel, like your hands are always contaminated. So it's also important to just wash it at the end of the day to prevent transferring bacteria from the cup, from the bottle, into your mouth. As you've mentioned, fecal oral routes. So you've said something when we started that microwaves were found to have
Fecal matter on it.
How did they get there? Your hands. Your hands. So our hands are not always that clean. Wash your bottle daily.
Yeah. So it is important to disinfect it at least once a week with, you can use vinegar or bicarbonate of soda to disinfect it. But also what you mentioned about water is clean and then why should I wash my bottle? It's because of also the saliva. Saliva has bacteria. You keep on introducing it to the bottle, and with time, these microorganisms are going to increase in number, and they'll produce something protective around them called plaque. So what you see is a slimy material around the bottle if you take time without washing it. So it's important to wash it every day, but disinfect at least once a week.
I've encountered that one.
Also, it's very important to wash and dry before you use. Yes, make sure the bottle is dry before you use it, and make sure you're washing all the compartments of the bottle, especially,
that complicated mechanism.
The parts where they have so many, all of that. Make sure you wash them carefully. Make sure you wash the bottle, the cover. Yes, the cover also. So it's not just putting water in the tap, putting your bottle under the tap and pour it. You can put, there are some objects, there's something they used to wash baby bottles,
the cleaning.
Because you have to go in and do a deep cleaning, right? And make sure afterwards, you don't keep using that same thing she talked about, the sponge. That when you wash with that, at least every week, make sure you wash that instrument that you're using to wash. Yes.
Hey, there's something else apart from the obvious gym going to they don't shower, go to the car absorb all the sweat, and then now they go change their clothes and come back and the bacteria is still there. Something else that came to mind was when we talked about bed sheets and all. You've come from outside and then you go sit on your bed. You've used public transport, you've been in public places, you've done whatever it may be. What do we do? Is there a routine when we come into the house to prevent extra spread of our...
Okay, yes, so that's why Oyibo people, they have cloak rooms, and they have like a compartment where when you get to your house, you remove your coat, you remove your shoes, anything that might have picked up bacteria outside. You don't walk into your house with all of that. So remove your coat, remove your shoes, and then you have a basin there. You wash your hands with soap and water before you walk in. Don't walk into your house with your shoes and the clothes, the outer covering that you have worn outside. So that usually helps to reduce the transferring bacteria from out or microbes, whatever it is, from outside your house into your house. So that helps a lot. Yeah.
Oh, okay. Now we could talk about so many different areas, including your cars. And by the way, when it comes to cars, here's the thing. Your windows are not as tinted as you think you are. So we see you when you're picking your nose in traffic and those boogers are flicked around the cabin of the car. That also contributes to but those conversations will come up later. So just to summarize, is there one sentence that you can give with regard to little habits that can lead to actually greater health benefits? Yeah.
Hand washing is the key. Hand washing prevents so many infections. And also it reduces the burden of hospitalization and using antibiotics unnecessarily. We're looking at conditions that are spread through the fecal-oral route. We're looking at respiratory infections like we saw for COVID. Yeah. So hand washing is very important.
Hand washing very important. Dr. Kelechi.
Okay, yeah. So for me, don't wait until there's an outbreak or there's an illness before you take your hygiene or hand washing seriously. And hygiene is not about expensive soaps or fancy things. It's about the basic things you can do consistently and intentionally to protect yourself from infections and also protect others from infections.
Yes, protecting others.
So my cue would be for people who can manage to walk around with disinfectants, a sanitizer, a bottle of soap. There are nowadays those small bottles that you can attach to your handbag that they have liquid soap in it. Just carry them around. There are some areas you might walk to. Yes, there is running water, but there's no soap. So you are privileged to have your soap with you. And then for men who think that because your reproductive organ is not so complex as ladies, Make sure after you've used your washroom, just wash your hands. It's also important for men to wash their hands.
Yes.
And also to wash under your nails. Yes, to
And keep
avoid
them short
harboring.
if you can.
Yeah, to avoid harboring bacteria.
All right.
So it is important to keep fingernails short because they harbor eggs of parasites. So especially for children, they keep on scratching their butts. They are getting those eggs from the butt, and they can easily spread them to other people.
Yes.
Not only children, but also adults.
Yes, there are also adults who scratch themselves back there. We need to talk. But for this particular episode, we've come to an end. Just remember, soap and water is better than having to cope with running stomach. Running water versus running stomach. You make the choice. And if you have anything that you found here that was useful or helpful or you didn't know about, please share the episode. Follow us on all our socials. That's at the Med Squad Pod. And stay hygienic for real. It could prevent so many long-term negative effects. We'll see you next time.